As the Dean, I would like to give you an idea of what we do,
and more importantly, how we do it.
whether we're teaching, learning, doing research, or interacting with the world at large.
And we are proud to say we do it the UP way.
This means living and working as ethical, socially and environmentally conscious individuals who are focused on making a positive impact on society. We get excited when lives are changed for the better. Doing things the UP way is all about enabling and inspiring our students to put their values into practice throughout their careers. Successful healthcare practitioners combine academic excellence with kindness, empathy, respect and tolerance. We teach, learn, innovate, impact and live the UP way.
Hello everyone, my name is Mani Bikanyo, Head of Marketing and Communications at the Faculty of Health Sciences. Firstly, I'd like to welcome our panel for the day, Deputy Dean of Teaching and Learning, Professor Vanessa Steenkamp, as well as the Manager of Undergraduate Student Administration, Ms. Anthony. Thank you so much for attending our School of Healthcare Sciences live stream. We'll also be listening to a message from the Dean, Prof. Tiaan de Jager, in a short while. Now, I know a lot of you have a lot of questions pertaining to the Healthcare Sciences section. In this section, we will be covering a few of your Q&As. So to those of you who are on Facebook, make sure to post your questions in the comment section, and those watching on YouTube, you can post your questions on the live chat. Now, there are numerous prizes up for grabs, so continue commenting with regards to this section, and you might win some giveaways. We have a voucher from Crisps, which is our healthcare sciences cafeteria, and you always need study material. So we are offering a bookmark voucher valued at 500 Rand. We also have a Tuck Student Gym membership for 3 months that is up for grabs to help you stick to your fitness regimen. So continue engaging with us to stand a chance to win. To interact with us on social media, please go to our hsup.co.za. It's as easy as that. And make sure to bookmark that page so that you can stay up to date with our current news with regards to the faculty. You'll also find our social media handles where you can easily connect with us. So please make sure that you use both hashtags, hashtag #LifeChanges and hashtag HSUP. So be sure to connect with us right now.
At the University of Pretoria's Faculty of Health Sciences, we like to focus on potential. The potential of our students to make a positive difference to the world around them. The potential to produce research that shifts boundaries. The potential to heal, to relieve, to recover and restore. Discover your potential and join the movement. Follow the University of Pretoria's Faculty of Health Sciences on Twitter, Instagram, Facebook, YouTube and LinkedIn to be a life changer.
So we've had a couple of comments coming through. So let's take a look at one of your comments right now. At Not Yet a Rich Mnisi says he cannot wait to have a great journey at the School of Healthcare Sciences with his conditional acceptance in the Occupational Health degree. Well, we look forward to meeting you, Sibs. Without further ado though, it is my absolute pleasure to introduce to you the tallest dean at the University of Pretoria, Dean of the Faculty, Professor Tiaan de Jager.
Good day, everybody. I am Tiaan de Jager, Dean at the Faculty of Health Sciences, and welcome to this live event hosted by Health Sciences as part of our hashtag ChooseUP initiative. So why should you choose to study at UP's Faculty of Health Sciences? Our faculty, situated on the Princehof campus, has a reputation for producing excellent healthcare professionals, changing lives globally. We are creative and innovative, as you have seen during crisis times like Feast Must Fall and now during the COVID pandemic. Our students successfully graduate on time. We are continuously transforming. Transformation of the curriculum, facilities, and the culture are important in addition to racial diversity. This keeps us relevant and competitive. With 43 departments across 4 schools, our faculty offers one of the most diverse range of programs for you to choose from. You can follow a career based on your passion within the School of Medicine, the School of Dentistry, School of Healthcare Sciences, or the Postgraduate School of Health Systems and Public Health. This session is focusing on the exciting opportunities in the School of Healthcare Sciences. Places for these programs are limited, and it includes areas like human nutrition, physiotherapy, radiography, occupational therapy, and of course, nursing sciences. Taking all these programs into consideration, the faculty maintains an average module pass rate around 95%. So your success is important to us. We have academic and mental health systems to support you in place, and our leading hybrid learning approach will ensure that you can continue achieving success the UP way. In addition, we are well renowned for our vibrant student life and the culture surrounding it. We want you to develop into your full potential in a safe and stimulating environment. Our staff are dedicated leaders in their respective fields and are passionate life changers. By using our advanced infrastructure, laboratories, libraries, leading research facilities, students at the Faculty of Health Sciences develop essential skills and gain reputable experience. At institutional level, UP ranked #1 in Africa and South Africa on the UniRank Global Ranking System for Universities. On the QS Global Ranking, we were within the top 1% globally for clinical medicine, immunology, and microbiology, And with the Times Higher Education rankings, we are the only South African university that ranked for SDG 3, that is Sustainable Development Goals for health and well-being, and are amongst the top 200 globally. We hope you will choose UP and join the Faculty of Health Sciences and become a life changer too. Enjoy the program, and I'll trust that we will answer all your questions today. Thank you.
Thank you, Prof. Diandiaga, for highlighting some of the great things about the Faculty of Health Sciences. Remember to keep engaging with us online, because you might just be one of our lucky winners for the 3 vouchers that are up for grabs. And already I can see you guys are tweeting us and engaging with us online, and we've got our first tweet. Actually, our next 3 tweets for the day. So firstly, we've got Lizelle, who says, I am looking forward to studying physiotherapy at the Faculty of Health Sciences next year. Next up, we've got Zaire, who says, my mother studied OT at Tuks. Soon I will join health sciences and follow in her footsteps. We assure you'll have a great time here at this faculty. And Raja says, nursing. Emphasis on nursing all the way. UP Health Sciences is the best faculty at the university to study nursing. I cannot wait. We also cannot wait to meet you, Raja, next year. Now, for those of you watching us on YouTube today, make sure to check out our YouTube channel. Remember to subscribe. Our playlists have so much to offer, with information about our faculty and the amazing projects that we are involved in, and the other exciting content from the Faculty of Health Sciences. Usually, we have a lot of questions from students about how they can transfer to a degree in health sciences. You'll be glad to know that this is possible. Watch the video.
If you're interested in pursuing a career in the medical field, but don't qualify to study medicine or dentistry, then consider one of our other highly regarded healthcare programs. With a healthcare sciences degree, you will have the opportunity to care for patients, hold a management position, start your own practice, or conduct research, thus contributing towards future healthcare innovations. The University of Pretoria's Faculty of Health Sciences offers 5 undergraduate programs within the School of Healthcare Sciences. These are physiotherapy, occupational therapy, radiography, dietetics, and nursing sciences. Physiotherapy involves a comprehensive approach to patient care. Emphasis is placed on the maintenance and rehabilitation of individuals and their overall physical well-being. Occupational therapy optimizes functional abilities and is aimed specifically at people who are at risk of occupational dysfunction. This involves helping those with physical limitations to perform important daily activities. In radiography, students master the art of using X-ray and ultrasound machines, as well as other forms of imaging technology for more accurate diagnoses. Dietetics promotes the quality of life among individuals and communities by means of nutritional care. Nursing sciences entails working in a multidisciplinary team to provide comprehensive care to patients. Being part of a healthcare team is rewarding in that it gives you the opportunity to improve lives daily. If you are creative, analytical, enjoy working with people, and are curious about the human body, consider a career in healthcare sciences. The Faculty of Health Sciences is equipped with advanced facilities and resources that promote interactive learning and a growth-oriented mindset. Here at UP, there is a diverse variety of healthcare programs that can match both your interests and your personality.
Thank you for engaging with us online. We have our first giveaway, which is the CRISP voucher. And we'd like to announce our winner. Our winner is Sianda Sibs. Thank you so much for entering. We will be in touch on how you can collect your prize. Now, next up, we are going to talk about our School of Healthcare Sciences. Our School of Healthcare Sciences houses several undergraduate programs ranging from physiotherapy, occupational therapy, radiography, dietetics, as well as nursing sciences. Before we hear more from Dr. Mabel Gekana, let's take a glimpse at what healthcare sciences can offer you.
It takes teamwork to treat a patient, and the University of Pretoria School of Healthcare Sciences provides the knowledge and skills that enable you to be part of the treatment and care process, even for a potentially life-altering condition. Nurses take care of patients from the moment they're admitted, as in the case of an incomplete spinal cord injury, where special care is required. From positioning the patient for X-ray imaging to reduce the risk of complications due to immobility, this daily regime continues all the way through to rehabilitation. The radiographer uses ionizing radiation for imaging of internal structures as a key diagnostic tool in different medical disciplines. They may also provide support during surgery. The images produced assist in proper diagnosis and the treatment plan required. Dietetics focuses on preventative, promotive, curative, and rehabilitative aspects of human nutrition. In hospitals, dietitians design a specific diet to facilitate the process of treatment and recovery. The patient's nutritional status is assessed, monitored, and optimized through special feeds. Physiotherapy focuses on physical rehabilitation to optimize the functional ability of the patient by means of joint mobilization and improving muscle strength and functioning. The rehabilitation program enables the patient to move independently. In this case, through strength conditioning, patients gain mobilization from their wheelchairs and ultimately are able to walk again. Occupational therapy aims to assist people with loss of function due to disability to optimize independent and optimal functioning in occupations across their lifespan. Occupational therapists enable individuals to perform activities of daily living and provide adaptations, assistive technologies, and home modifications. If you have a passion for healthcare and want to change lives, the School of Healthcare Sciences in UP's Faculty of Health Sciences can prepare you in your journey. Our academic programs are embedded in research that matters. Become a life changer and put your commitment into practice.
Good day, everyone. I'm Mabel Gekana, Acting Chair of the School of Healthcare Sciences. I'm going to take you through what we do in our school. The school is made of 5 departments: human nutrition, nursing sciences, occupational therapy, physiotherapy, and radiography. I'll start off with the Department of Human Nutrition. The Department of Human Nutrition offers a bachelor's degree in dietetics. It is a 4-year degree that focuses on biological sciences, health sciences, human sciences, and there's a lot of communication and management sciences. It's all about healthy eating and healthy living. What characteristics do you need to become a dietitian? You must obviously have good communication skills. You are going to be advising people on what to eat and what not to eat. You must be independent and motivated. You must also be a scientific thinker. And most importantly, you must enjoy working with food, because you are going to be advising people on what to eat and what not to eat, and give reasons for that. Dietitians do the following. They work in hospitals and in communities. They counsel people in the way they should eat, especially for the people who are not well. There are some conditions for which a person is not able to eat the food that they used to enjoy. So a dietitian comes in handy there to advise on the alternatives that one can eat while still maintaining a nutritional balance. We come to the Bachelor of Nursing Science. It is a 4-year degree as well, and focuses on the following. Nursing is about caring. Nurses care for the people who cannot care for themselves at that point in time. For whatever clinical condition, you find that you are not able to take care of yourselves. But then, it is not just basic caring. There is science to it. So there is a scientific way of caring for different clinical conditions. As a nurse, you'll be providing a service to others, and most importantly, not forgetting yourself. knowledge and skills in everything that you do is very important. And as a nurse, you are not going to be working alone. So teamwork is very much important. Nursing is a career with many opportunities. In nursing, you'll be trained for general nursing, which involves people with different needs in hospitals, clinics, or even in private practice. There's also a field in midwifery, where you are going to be taking care of the mother and the baby. And this one is before, during, and even after birth. Nursing also prepares you for community service, community nursing, that's what we call it. That is where we educate communities about prevention of diseases and how to promote good health. There is also psychiatric nursing. We know this world is not a very friendly world at times, that there are some conditions that can disturb a person's mental status. So hence we have a specialization in the field of nursing for where care is provided for all ages with mental illnesses or mental distress. We come into the profession of occupational therapy. They also offer a 4-year degree in occupational therapy. Occupational therapy is a healthcare profession in which people with physical or mental diseases or disabilities are treated by means of participation in activities of daily living. They call it ADL. The career opportunities in occupational therapy are the following. Primary healthcare clinics, where you engage with the communities, or you go straight into the community centers. Even at tertiary hospitals, there's opportunities. You can be a lecturer. At schools, where you work with growing children with disabilities and try to help them to be able to know that they can use whatever limbs they have to take care of themselves. There's also private practice in occupational therapy, so you are not limited to being employed by somebody else. Now we come to the profession of physiotherapy. It is also a 4-year degree in the School of Healthcare Sciences. Their focus is on sports and rehabilitation. They work with adults and even patients with neurological conditions. Spinal cord injuries, they help you. They help you to know how to take care of your back. Pediatrics, whatever conditions are there, they can help the pediatrics as well. They also work in ICU and high care units in hospitals. They work even with orthopedic cases, and you can also find them in public health. The physiotherapists treat the following problems, and they work in the following scenarios. People who are experiencing pain that they cannot explain, where there are muscle spasms, where there are muscle weaknesses, or muscle imbalances and dysfunctions. Physiotherapists always come handy. Movement patterns, they'll teach you how to stand up upright, keep your back straight, and make sure that there's balance and proprioception. Other career opportunities for physiotherapists include private practice. They can also work in big and small hospitals and even in clinics. They also work in nursing homes where people are maybe elderly and they're somehow losing their sense of balance or they're not able to do certain activities. They are there also physiotherapists at schools, at public health, and even tertiary institutions as academics. Now we come to the profession of radiography. Radiography has always been offered as a 3-year degree, but from this year onwards, we started off with a 4-year degree. There are three areas in which you can specialize at the University of Pretoria. Diagnostic radiography, which we offer from the undergraduate level, and even honors, masters, and going up to PhD. Radiation therapy and nuclear medicine, we offer them only at postgraduate level. And very soon, we'll be having ultrasound as well, which will also be at the postgraduate level. Radiographers use a lot of different technological equipment to produce images of internal structures so that diagnostic information can be obtained so that a patient can be treated or even managed better. Differentiating diagnostic radiography from radiation therapy. Radiation therapists, they work mainly with cancer patients. We have always been told that cancer is incurable, but with radiation therapy, they use high dose of radiation to retard the growth of those cancer cells. And then we have the field of nuclear medicine. The field of nuclear medicine, they use radiopharmaceuticals that are injected in the body, and the gamma cameras are able to pick up those radiopharmaceuticals and demonstrate to the radiographers and nuclear medicine physicists as to where the problem areas are. Now, looking at the whole School of Healthcare Sciences in the nutshell. Being 5 departments, we know the importance of interdisciplinary teaching and learning. And for that, our students are brought together in specific modules where they are being taught professionalism and leadership. They also learn research together, and they also go out to the communities in community engagement together. The clinical learning, we have state-of-the-art facilities. Our biggest center is the Steve Biko Academic Hospital. And close to it, we have Tshwane District Hospital, and we have Kalafong Hospital, which has also been upgraded to the tertiary level. We have Mamelodi Hospital, Tembisa Hospital, Vescopis, communities, and there are even more other facilities according to the respective disciplines. With all said, I say, come and join us at UP. Come and fly with us. Choose UP. Thank you.
Thank you so much, Dr. Kekana, for highlighting the various opportunities in healthcare sciences. Now, just a reminder that we are also on Instagram, just in case you like to show off some drip. So click on the follow button and get a glimpse into what we do here at the Faculty of Health Sciences. I can see you are still engaging with us on social media, which is fantastic, so keep the tweets coming. This live stream is the bomb. Loving the videos. Thanks for all the effort. And that is at Verosa. Thank you so much, Verosa, for tuning in. We appreciate the feedback. At Ronald says, watching the live stream as a family today. So glad that my parents can be part of this experience too. Hoping to study OT next year. We hope to also see you here with us next year, Ronald. And as Unique says, the Faculty of Health Sciences at UP produces exceptional healthcare professionals. I couldn't agree more. Thank you so much for the comments. Thank you so much for your comments. We have also now selected our winner for the bookmark voucher. And I do have the right envelope, yes. The winner of the bookmark voucher is Diana Dondase. Congratulations. Now, we are going to move on to our Q&A section. It's time for us to speak to our panelists, Ms. Celissa Anthony and Professor Vanessa Steenkamp. Now, the first question directed to Ms. Anthony is, what if I am not selected for physiotherapy, radiography, OT, nursing science, sports science, or clinical medical practice?
Thank you for that question, Mani, and welcome everyone. So if you're not selected for any of the healthcare sciences degrees that you've applied for, don't be disheartened. I would suggest that you apply, look at your passions, look at other interests that you have, and then apply for one of the other degrees, and then reapply again to be selected as a university student. We have an excellent 3-year Bachelor in Sports Science degree course if you do not get selected into physiotherapy. So that would be a great opportunity for you to branch off to in that program. Also with our clinical medical practice, if you have a passion in the human sciences or biological sciences, maybe explore a degree in BSc and then apply again to the Bachelor in Clinical Medical Practice. So don't be disheartened, like I say, there are other alternatives. We also reserve a number of places for students that have already started a degree, and you can branch off that way. Unfortunately, based on the structure of the degrees, you won't be able to start at the beginning of the year or in the middle of the year. So if you are selected, you will then be considered based on your current degree to start in the following year.
Thank you so much, Salisa. And Chanel's also asking as well, how and when will she know if she is selected for one of those degree programs?
So our applications closed at the 31st of July, and I must just say also that we've received a little under 11,000 applications that staff has been working non-stop processing applications and to make sure that we notify all the learners as soon as possible. So we will, matric learners should be able to receive feedback on the status of the application within the first week of September. So make sure that you log onto your student portal where you can track your application status.
Thank you, Ms. Anthony. Now I'm going to move on to Prof. Vanessa. Megan Moodley wants to find out on which campus will she be attending class?
Good day, and thank you for joining us today. Depending on the department in which you are in the healthcare sciences, you will be spending between 1 to 2 years dually between the Prince-Hoff campus, which is Prince-Hoff North and South, as well as going to the hospital, but also at the Hatfield campus with doing some of the subjects there. So as I said, it depends on which of the departments, but we will welcome you in your final year also to the Prince-Hoff campus. You'll also be placed in some of the clinics as well, so that is off campus, just to also mention that we must be aware that our students get training there, especially in the healthcare sciences, and they'll be placed at sites which are appropriate for training.
Thank you so much, Prof. Vanessa. And there's also another follow-up question by Senzo, who would like to find out when the academic year will commence, especially considering the COVID-19 pandemic.
Yes, Mani, that is quite a difficult question to answer because we are not sure when this will happen due to the matric year maybe being extended or the marks being extended to when we get it and when we can actually start. Concerning the first years, we expect, or we usually have our orientation at the end of January, and our courses all start early in January in our faculty due to the full program that we have, but this may be extended, and I would urge people to please look at the website and look at the dates for starting.
Thank you, Prof. And I think lastly, on your end, one of the most crucial questions that a lot of parents and students always worry about is safety. And Pravir would like to find out, is it safe on campus?
That is very important. We are sure to ensure the safety of our students on campus. The university as a whole works on an electronic access system, and that it works with your student card. You need to be a registered student to get access. So it's the turnstiles or other electronic devices that we have that will then open up the gate for you for entry. We have 24-hour security at all our campuses. There's also a helpline that can be called if there are problems, that you do require somebody to assist you in what means whatsoever. We also have spaces for students also to park their cars as well, so that their cars are safe too and that they get out in a protective environment. And also taking the COVID situation into in keeping that in mind, is that we naturally keep social distancing. We've got stations at all the doors or the buildings for sanitizing hands, wearing masks. We provide our students with training, especially when they go into the clinical field or into work integrated learning or the communities. They are provided with protective equipment so that they've got their masks, their visors, and everything that is required so that they're safe. And lastly, that I could also mention that we've got green routes that ensure the safe access between different buildings as well, to ensure safety, and these are also guarded so that we know that our students are safe.
Thank you so much, Prof. Steenkamp. Now I'm going to move to Ms. Anthony. Mthokozi Sintuli wants to know, how does he calculate the APS?
Thank you for that question. It's one that we get a lot from learners. So your APS, or your admissions point score as it's called, is calculated based on 6 of your school subjects, and that excludes your life orientation.
Thank you so much, Celissa. Now, Ms. Anthony, last but not least, our final question from Tebatso. He wants to know, will the NBT be used for the selection of 2021?
So for 2021, the university has been monitoring the situation quite close over the past few months. And due to the impact and the challenges that we had, the faculty reviewed their selection processes and decided that the NBT will not be part of our selection for the 2021 intake. So matric learners will be considered based on their final grade 11 promotion marks. They just need to remember that the final grade 12 results will still remain the determining factor of whether you retain your place that was offered to you. So if you are selected, it does not mean that you should now start relaxing. You need to make sure that you still study very hard in order to meet us and be one of our students in the coming year for 2021.
Thank you so much, Ms. Anthony, and thank you so much, Professor Steenkamp, for joining us today and helping us answer some of the questions that concern our parents and our students. Thank you. Now, moving on to one of the most important aspects about being a student, student life. Here at the Faculty of Health Sciences, our students have an exciting student life. And if you want to find out what that looks like, check this out. Our final guest for the day is one of our very own students. Let's give a warm welcome to Siyanda Mnisi to give us a bit of insight into the life of a health sciences student.
Good morning, everyone. My name is Siyanda Mnisi, and I'm a fourth-year student at the University of Pretoria's prestigious Faculty of Health Science. I've served on several student support and leadership structures within the residences and the faculty throughout my time at the university thus far. And I must say that it's evident that we pride ourselves in ensuring that students not only develop into amazing skilled healthcare workers by the time they finish their journey in Princehof, but we make sure that they develop into holistic, reputable citizens that are able to engage in a variety of discussions and activities after obtaining their degree. This can be illustrated through the faculty's mentorship program, where a third-year student is allocated about 4 or 5 first-year students to mentor and to guide on how to achieve the perfect balance, according to their own study preferences. This also allows you to form relations and to engage in conducive social spaces with people in years above you, those who have walked the path you are yet to start. We also have access to faculty student advisors that are there to facilitate and guide you through any problems that you might have, or even refer you to additional student health support services. The social spaces that are found within our campus would not be possible without a tight security network that allows students to relax and feel safe within the parameters of our university space. Our security boasts itself in being the friendly faces on campus, and they're always willing to assist with any security problem you might come across. Initiatives such as the Green Route can be found throughout campus and in some of the teaching hospitals, assuring students that their safety is being prioritized. This allows them to fully immerse themselves in their academics as they engage in teaching and learning opportunities without having to worry about their safety. Our campus is a peaceful one that has lots of social spaces where students can unwind and relax after an intense lecture or test, and we have amazing coffee shops where one can grab a quick coffee just to keep them going for the rest of the day. However, ladies and gentlemen, our main purpose here is to study and obtain our degrees, and it must be said that we take that as our utmost priority. We have a variety of resources, such as an anatomy study resource or a museum, that students can utilize fully to improve their knowledge and understanding of their coursework. Libraries both in the Harvey Snyman building and the Basic Medical Sciences building that are equipped with a great selection of books, internet and printing services, and study cubicles for the days on campus that just don't seem to end. Access to online learning materials and ebooks via the library's online services make navigating through your degree in our faculty an enjoyable journey. So I encourage you to choose UP and choose the Faculty of Health Sciences, where lives are changed and where dreams get turned into reality.
Thank you so much, Sia. I am sure a student's perspective makes it even more exciting for those of you watching. For viewers using LinkedIn, remember you can follow us using the following handle. Now it's time for us to hand out our last prize. The 3-month Prince of Gym subscription is our last prize for the day, and will help you find a suitable routine when you join us here at Health Sciences next year. Here we go, we've got a name, and the winner is Ansa Janse van Vieren. Congratulations. Now, it has now come to an end of the program. I'd like to take this opportunity to thank all of our guests who have contributed to making today an informative session, and we hope that you gained as much insight as you needed. Good luck for your final exams, because your matric marks do matter, and see you next year at the Faculty of Health Sciences. Remember to choose UP. Thank you.